Dear scholars, in this video I will discuss about peptic ulcer disease, including how gastric juice is secreted and regulated. I will also cover types of gastric ulcer, their diagnosis, causing factors and symptoms of peptic ulcer disease. In next video, I will discuss about the classification of drug used to treat peptic ulcer disease. Here is the basic anatomy of the peptic region of GIT. This hollow muscular tube is known as esophagus. This portion is stomach and this portion is duodenum. Now let's try to understand how gastric juice is secreted and regulated. The image you are seeing on the screen. I have taken this image from the Medical Pharmacology by K.D. Tripathi. It seems a bit difficult to understand. I have tried to make it easier and make this illustration. What I would like to discuss first are the phases of gastric juice secretion. Basically, there are three phases of gastric juice secretion. First one is cephalic phase, second one is gastric phase, and third one is intestinal phase. The cephalic phase of gastric juice secretion is being stimulated when you see good food or you think about good food. The taste and smell of delicious food can stimulate cerebral cortex of the brain, and this information is being forwarded to the hypothalamus, and from the hypothalamus, this information is being forwarded to the dorsal nucleus vagus. And right from here, vagus nerve is originated and takes this information to the various part of the stomach and stimulate the secretion of gastric juice inside the stomach. Now let's discuss about the gastric phase of the gastric juice secretion. Earlier I have talked about the cephalic phase. In cephalic phase, there is no food inside the stomach. But in gastric phase, your stomach is partially or completely filled with the food. When your stomach is filled with the foods, it is stretched. It terms as distension or stretching. There are numbers of stress receptors present outer side of the stomach and take this information to the dorsal nucleus vagus. From there, vagus nerve carries this information back to the stomach and stimulate the secretion of the gastric juice. In gastric phase, about 60% of gastric juice is being secreted. Next, let's see what is happening inside the stomach lumen. There are special cells present in the antrum region of the stomach, and these cells are called G cells. When these cells come in contact with the partially undigested protein, they release gastrin hormone into the blood vessels present in the lining of the stomach. Before getting understand what gastrin do with the parietal cells, let's try to understand how hydrogen ion is being produced inside the parietal cells. There are lots of mitochondria present inside the parietal cells. In the process of respiration, they release CO2 inside the parietal cells. This CO2 bind with the water present inside the parietal cell and produce carbonic acid. Later this carbonic acid breaks into bicarbonate ion and hydrogen ion. The other important thing happening here is that the negative ion pushes out from the parietal cells into the blood vessels. I mean bicarbonate ion pushes out from the parietal cells into the blood vessels. The releasing of bicarbonate ion into the blood vessels from the parietal cell is termed as alkaline tide, and this causes chloride ion move into the parietal cell. The parietal cell has chloride channel through which chloride ions move out from the parietal cells into the lumen of stomach and bind with hydrogen ion and produce hydrochloric acid, HCl. Here one important thing you need to remember is that HCl is produced by parietal cell, whereas pepsin is produced by chief cell. There is another important thing is happening by means of gastrin. Here gastrin bind with the CCK1 receptors present on the wall of the chief cell. Inside the chief cell, gastrin increase calcium ion. These calcium ion stimulate the enzyme vesicle present inside the chief cell. Subsequently, these enzyme vesicle fuse with the membrane of the chief cell and release pepsinogen into the lumen of the stomach. Later, this pepsinogen converted into the pepsin. Later, I will discuss about the drugs used to treat the peptic ulcer disease. But for this moment, please look at these four groups of medicines. Acetylcholine is very important type of neurotransmitter and it binds with M3 receptors present on parietal cells as well as chief cell and increase the calcium ions inside the chief cells as well as parietal cells. In resulting, secretion of HCl and pepsin is increased. There are other very important cells present on the lining of stomach are called Ecl cells. They are responsible to produce histamine. And these histamines bind with the H2 receptors present on the membrane of parietal cells as well as chief cells. Histamine causes increasing of calcium ion inside the parietal cells as well as chief cells. As we know that increasing of calcium ion increase the secretion of HCl as well as production of pepsin. Now I will discuss about some inhibitory process occurs naturally inside the stomach. This is D cell or delta cell present on the antrum region of the stomach. When hydrogen ions exceeded in the stomach, they stimulate D cells and D cells secrete somatostatin. These somatostatin bind with the somatostatin receptor present on the G cells and inhibit the secretion of gastrin. So this way gastric juice secretion is inhibited naturally. Prostaglandins, a type of inflammatory agents, also inhibit gastric juice secretion. Prostaglandin receptors present on the membrane of the parietal cells as well as the chief cells. Peptic ulcers are basically three types according to region they affect. First one is esophageal ulcer, and second one is a gastric ulcer, and third one is a duodenal ulcer. Let's see what causes esophageal ulcer. First one is a GERD. And this is the very common cause of the esophageal ulcer. And GERD is the condition occurs when stomach acid flow back into the esophagus. Second one is infections. Certain viral infections cause esophageal ulcer. Third is irritant. Irritants like alcohol, smoking, tobacco and certain medications cause esophageal ulcer. Other factors include radiation and chemotherapy. Symptoms of esophageal ulcer. You feel pain when you ingest food, heartburn, chest pain, nausea and vomiting. Also sometimes you experience blood vomiting. Esophageal ulcer can be diagnosed by means of endoscopy and blood tests. The most common causes of gastric and duodenal ulcers are H. pylori and non-steroidal anti-inflammatory drugs. The bacteria Helicobacter pylori and painkillers damage the stomach wall and form the ulcer. This bacteria H. pylori can infect the people of all ages and they live in the stomach lining. Although they are not harmful for the all people, but in some people these bacteria can damage the stomach lining and form the ulcer. The frequent use of painkillers or anti-inflammatory drugs like ibuprofen, indomethacin, diclofenac, nimesulide, naproxen, aspirin, etc. can damage the stomach lining and form the ulcer. The most common symptoms of gastric and duodenal ulcers are heartburn, pain in stomach, bloating, intolerance to the spicy and fatty foods, nausea and vomiting. Gastric and duodenal ulcers can be diagnosed by the lab test for H. pylori, endoscopy and contrast X-ray. In next video, I will come up with the drugs used to treat peptic ulcer disease. Thank you so much.